Hello, my name is Neil Shah, and my dissertation topic is the role and impact of big data analysis against the spread of COVID-19 pandemic outbreak using the AI and IoT technologies. So, basically, the COVID-19 is identified in 2019 over 704 million cases and 6 million deaths globally by the March of 2024. So, stressed healthcare system and economies distribution worldwide, and when the COVID-19 happened, all over in all over the world, the healthcare systems and economies disturbs. So role of technology in management. So basically I cover three technologies. First of all, it's big data analysis, which used to enhance tracking and forecasting of virus spread. Second is AI. It's accelerated vaccination research and diagnostics. IoT. Third is IoT. It's improved the real-time health monitoring and contact tracing. And my aim is to investigate an effectiveness of big data analysis, AI, and IoT in managing COVID to address the challenges like privacy concern and integration of technology in pandemic response. There are some objectives which there are some objectives. The first, the research shows big data utilization during pandemic management, which is used to covering, tracing, and forecasting and delay COVID-19 spread using with the AI. Second objective is to study the role of IoT in health real-time monitoring and disease surveillance to identify the application of contact tracing, health monitoring, and environmental sensing during the COVID-19 surveillance. Uh, the the study finds obstacle to implement and integration big data, AI, and IoT in pandemic management, including ethics, privacy, scaling, interoperability, and ethical dilemmas. The fourth one is provide suggestion for strategy to overcome identified challenges. It means it gives a practical remedies and improve the excellent application of tools which are knowledge to address the facing challenges. The fourth one is assesses ethical implication of warrant privacy protection. Basically, it's focused on the privacy maintenance and ensuring public benefits while using the technology. The third one is rationals. So it basically on a three things: big data analysis, artificial intelligence, and Internet of Things. So in big data analysis, there is things are covered: data-driven decisions, which cover data allow the aggregation and analyze of vast amounts of health data quickly, which is crucially in the understanding the spread of the virus and effectiveness of inventions. The second is resource allocations. It means enables healthcare system to optimize resource allocation. The second one is artificial intelligence, which covers rapid diagnosis and prognostics. The which mean complex medical data at uncertain speeds, leading to quicker diagnosis and predict analysis for patient outcomes. The second is vaccination development. It helps to identify the potential vaccination candidate and simulate their effectiveness, reducing the timeline for vaccination development. And the third thing is Internet of Things, which means it continuously monitoring the disease, how it spread quickly and in the real time. And the second one is contact tracing. That means the contact tracing process quickly identify and notifying individually who may have encountered encounter with the infections, so people will know about it in a real time. Now we move forward. It's integration and synergy. So basically it owns a comprehensive surveillance system, so people will know about the with the use of technology, big data analysis, and AI and IoT. It creates comprehensive surveillance systems. So it enhances real-time decision making and long-term strategy planning in public health monitoring. The second thing is scalability and flexibility. That means Technology offers scalable solutions that can be adapted for the future health crisis, ensuring preparedness and rapid response capabilities. The Now we move forward, it's addressing challenges. It's a data privacy and security and bridging the digital divide. So data privacy is about the privacy, how data protection during the COVID-19. Bridging and the digital divide, it means ensuring equitable access to this technology across different socio-economic groups. Now we move forward. It's a literature review. So literature review basically based on the three technologies. So big data analytics, artificial intelligence, and Internet of Things. So what are the impact of big data analysis? It enables real-time outbreak tracking and resource allocation, improve predicted accuracy for the public health decision. So people will know about it. Challenges. So basically we face the privacy and data integrity concern, integration issue with the disparate data sources. uh, the second is artificial intelligence. It helps people to know enhance the diagnostic speeds and uh, accuracy. And the second thing about development and prediction of the side effects of the vaccination. Challenges are the algorithm basis and lack of transparency. And the second is ethical concern in decision making. The IoT is and the third is IoT. So it's a facility of real we facilities of real time health monitoring and efficient contact tracing. And we face some issues regarding security vulnerability and data privacy issues. Now move forward to methodologies. Methodology are basically based on research design, data sources, how we collect the data, how we sampling the techniques. So sampling this techniques, data analysis, ethical consideration, limitations, and the fourth thing is uh, consider consideration and expected outcomes. So we design AI and IoT based techniques. We use the data sources like the health database, public records out, and IoT outputs in a data collection. There we use the data aggregation software and analytics performs. Sampling techniques are random sampling from databases. Qualitative data are like proposing sampling of professional involved in a pandemic management. Ethical consideration is based on the committee approval and consent. The limitations we faced is the technical variable in the technology availability and maturity. And the expected outcomes is evidence based on the recommendation from the technology development. Theoretical, it means the enhanced understanding of technological rules in pandemic management. Now we move forward to research outcomes and decisions. So this is the research you can easily get the idea from the COVID-19 cases reduction over the time. So over the time and the sec and over the time. uh, Now we move forward. So COVID-19 pandemic management, how it works. So big data analytics is a reduction in the case numbers, data driven decision making. There are some issue we faced. It's ethical concern, integration issues. With the using of AI, we get the diagnostic improvements and accelerated vaccination development. Using the IoT, we can get the idea. We can get tracing contact tracing capabilities and real-time health monitoring system. Now we move forward to the research methodologies. You can see employees with it's a quantitative analysis and qualitative data analysis. The data collection, quantitative analysis contain data collection, which is statistical, and it goes to the two parts. So it's a descriptive statistic, regression analysis, use use analysis. And the quantitative analysis, it contain data collections like interviews and focus groups. So it contain thematical analysis, identify themes, depth understanding, and comprehensive insights. Now we move forward to the conclusion. So conclusion is effectiveness of technology. So the research confirm that big data analytics, AI and IoT significantly enhance the capability of healthcare system to monitor, predict and manage COVID-19 pandemic using big data, artificial intelligence and Internet of Things. So big data analysis proved crucial of predicting outbreak trends and optimizing resources allocations. So second, artificial intelligence accelerate the development of diagnostic tools and vaccination, improving response time and patient's outcome. And IoT is mainly focused on the real-time health monitoring effect. Now move forward to the study. The study also highlighted some challenges. So you can see the from the image the digital technology from pandemic preparedness and the response. So first of all, it contact tracing, quarantine, and self isolation. The the second thing is how, the infection peoples. The third is clinical management and planning and tracking, and the third one is medical supplies. So this is all my COVID-19 pandemic. So I developed some application. So using that application you can get the idea how much people can infect. If I have a fever of 300 150 or 200, then I was affected or not. I'll show you in the application on my dashboard. So you can see here it is a data collection module. So we allocate some data collection. The second thing, we run the program and we can see it from here. Once I go on run all the program, we go to the visualization of the data. We got the one chart with allocated count and target. Once we run this program, we got this how distribution of age, distribution of test BPs, distribution of cholesterol, distribution of thalassaemias, and the old peak. This is a data processing. So how the data is processed, so shape of training set, we can put a training set according to the uh, age, according to the code. This is the module accuracy. It's 0.8524. um, and one and after that we run this program. The data process shows uh, the output here. This is the output. And once we run all the program, we got heart disease prediction dashboard. If I put here is my age, it's a 25, sorry, 26. I'm a male and uh, I have a typical engineer, and my heart rate is 200. And if I you got a prediction result, so the predict chance of get heart disease is 78 percentage. So basically this is the sample of how people with affected with the different kind of infections, and how it impact with the age, and we got the proper result after using this code. Thank you so much.